Red blood cells normally live for about 120 days, but what happens when they are destroyed too soon? This is hemolytic anemia, when red blood cells are destroyed faster than they are produced. When red blood cells are destroyed too early, hemoglobin spills out. This leads to jaundice, hemoglobinuria, and pigment gallstones. In response, the kidneys release more EPO, stimulating the bone marrow to increase red blood cell production. But when the bone marrow can no longer keep up, anemia symptoms develop. To classify hemolytic anemia and explain the causes, it can be congenital or intrinsic versus acquired or extrinsic. In the intrinsic part, we find hemoglobinopathies, which includes sickle cell anemia and thalassemia. And here we can see that the red blood cells are deformed. In the intrinsic part, enzyme defects are also common, which includes G6PD deficiency and pyruvate kinase deficiency. Membrane defects are also included in this category, including spherocytosis, where the red blood cells are more circular. In the extrinsic versus acquired category, immune-mediated causes are autoimmune hemolytic anemia, which can be warm or cold, AB0 incompatibility, or SLE or CLL. The extrinsic category also includes non-immune mechanical destruction, which includes prosthetic heart valves, infections, for example, malaria, or hypersplenism. The classification can also be divided into intravascular versus extravascular. Intravascular, we see AB0 incompatibility and complement-mediated destruction. The extravascular, red blood cells defects or warm versus cold agglutinin disease can be found. The signs and symptoms of hemolytic anemia are signs of anemia, which includes fatigue, pallor, tachycardia, palpitations, and dyspnea. And in severe cases, it can also lead to chest pain. Jaundice is also a symptom. Cola-colored urine is also a symptom which may be included. Splenomegaly and pigment gallstone, which I described previously. To diagnose hemolytic anemia, blood tests are included, and in these blood tests, decreased hemoglobin, decreased red blood cells, and decreased hematocrit, which are signs of anemia, can be found. Increased numbers of reticulocytes and increased amount of LDH, which is a marker of red blood cell destruction, and normal or increased unconjugated bilirubin, which is a sign of hemolysis. Next part is Coombs test, which can be divided into direct versus indirect Coombs. In the positive direct Coombs, red blood cells are coated with autoantibodies, which can be seen in autoimmune hemolytic anemia or immune complex mediated hemolysis. A positive indirect Coombs shows free-floating anti-red blood cells antibodies in serum. You can do a peripheral blood smear, where this is supposed to be a microscopic slide. And in the microscope, we can see schistocytes, which are deformed red blood cells. The fragmented red blood cells suggest destruction. A urine analysis typically shows hemoglobinuria, which I described before, a cola-colored urine. The first-line treatment of hemolytic anemia is methylprednisolone, 1 milligram of kilogram body weight, is needed. Blood transfusion is indicated if there is severe symptoms or if hemoglobin is below 70 grams per liter. Specific treatment can be based on cause. In case of mechanical destruction, splenectomy, heart surgery may be indicated, or treatment of malaria. In warm autoimmune hemolytic anemia, glucocorticoids are indicated, which suppress immune attack. In cold autoimmune hemolytic anemia, rituximab is indicated, which targets immune cells. In drug-induced autoimmune hemolytic anemia, the patient should stop the drug immediately and may need glucocorticoids and plasmapheresis. Supportive care may be needed, for example, hydration to prevent acute kidney injury and folic acid supplementation in chronic hemolysis patients. So that's hemolytic anemia, a condition where red blood cells are destroyed too soon, leading to anemia, jaundice, and organ damage. Diagnosis relies on blood tests, Coombs tests, and smears. Treatment depends on the cause, but steroids, transfusions, and hydration are key. If you found this helpful, like and subscribe for more medical breakdowns. See you next time.